Hello viewers, welcome back to the channel. My name is Mohammad Sohail and today we are going to see what is conjunctivitis. As you all know, this is very common infection nowadays. So without any further delay, let's begin with our today's session. First of all, this is the anatomy of eye. Eye consists of eyelid, pupil, sclera and iris. Now coming to the introduction. The conjunctiva is a thin membrane that covers the inner surface of the eyelid and the white part of the eyeball, that is sclera. Conjunctivitis is one of the inflammation of conjunctiva. Inflammation of the conjunctiva is called conjunctivitis, which makes the white of the eye appear red. Now coming to the definition. Conjunctivitis is an inflammation or infection of the transparent membrane, that is conjunctiva, that lines the eyelid and covers the white part of the eyeball. When small blood vessels in the conjunctiva becomes inflamed, they are more visible. This is what causes the white of the eyes to appear reddish or pink. Conjunctivitis is also known as pink eye. This diagram shows the conjunctivitis infection when sclera part of the eye become red. As you can see from this diagram, the eye of the person become red and also there is inflammation. So this is called conjunctivitis. Now coming to the risk factor of conjunctivitis. Exposure to something for which the person have an allergy, that is allergic conjunctivitis. Exposure to someone infected with the viral or bacterial form of conjunctivitis. Using contact lenses frequently is also the risk factor for conjunctivitis. Microbial infection, fungus, etc. Now coming to the causes. First, viral conjunctivitis, which is caused by adenovirus and HSV, that is herpes simplex virus. Second, bacterial conjunctivitis, which is caused by Staphylococcus aureus, Streptococcus pneumoniae, Haemophilus influenza, Chlamydia, Trachomatis. Then third, allergic conjunctivitis, which is caused by pollen, perfume, cosmetic, smoke and dust. Then last is chemical conjunctivitis, which is caused by acid or alkalis. So these are the causes. Now coming to the types of conjunctivitis. First, viral and bacterial conjunctivitis. Viral conjunctivitis and bacterial conjunctivitis may affect one or both eyes. Viral conjunctivitis usually produce a watery discharge and bacterial conjunctivitis often produce a thicker yellow-green discharge. Both viral and bacterial conjunctivitis can be associated with colds or with symptoms of a respiratory infection such as sore throat. Both viral and bacterial types are very contagious. They are spread through direct or indirect contact with the eye secretion of someone who's infected. Adult and children alike can develop both of this type of pink eye. However, bacterial conjunctivitis is more common in children than it is in adult. So this diagram shows both the types, that is viral conjunctivitis as well as bacterial conjunctivitis. Now coming to the allergic conjunctivitis. Allergic conjunctivitis affect both eyes and it is a response to an allergy causing substance such as pollen. Most allergic conjunctivitis can be controlled with allergy eye drops. This is allergic conjunctivitis and which is affected both the eyes. Now coming to the toxic conjunctivitis. Toxic conjunctivitis typically occurs with constant use of topical ocular medications. The reaction may take days to years to develop. There also appears to be dose response effect with regard to preservative concentration and total amount of preservative containing medication used. It implies direct damage to ocular tissue from an offending agent, usually a preservative or medication. This diagram shows the toxic conjunctivitis. Now coming to the pathophysiology of conjunctivitis. First of all, microbes enters into the eye on contact with infected object. then the eye become inflamed, and then blood vessels of eye dilate, and then swelling and redness start. So this is the complete pathophysiology of conjunctivitis. Now coming to the sign and symptoms. First, tenderness of the eye or pain, which can be severe in the cases of irritant conjunctivitis, and swelling of conjunctiva, that is chemosis. Then second, itchiness. Third, body HS. Fourth, photophobia. Fifth, redness of the eye or inner eyelids, that is hyperemia. Then sixth is discharge and tear. Then common signs and symptoms include fever, sore throat, runny nose, swelling of the eyelids. Infection usually begins with one eye but can quickly spread to other eye in case of viral or bacterial conjunctivitis. Then diagnostic tests include first history collection, second physical examination, third culture of secretion, fourth conjunctival scraps for cytology, then conjunctivital incisional biopsy. So these are the diagnostic tests for conjunctivitis. Now coming to the medical management of conjunctivitis. The management of conjunctivitis depend on the type. Most types of mild and viral conjunctivitis are self-limiting benign condition that may not require treatment and laboratory procedure. Management of bacterial conjunctivitis include if the infection is bacterial, the doctor may prescribe antibiotic eye drops as pink eye treatment, and the infection should go away within several days. Antibiotic eye ointment in place of eye drops is sometimes prescribed for treating bacterial pink eye in children. An ointment is often easier to administer to an infant or young child than are eye drops, though the ointment may blur vision for up to 20 minutes after application. With either form of medication, expect signs and symptoms to start getting better in a few days. Topical antibiotics also used in case of bacterial conjunctivitis. Fluoroquinolones, sodium sulfacetamide or trimethoprim for 7 to 10 days. Now, management for viral conjunctivitis. There is no treatment for most cases of viral conjunctivitis. Instead, the virus needs time to run its course, up to 2 or 3 weeks. Viral conjunctivitis often begins in one eye and then infect the other eye within a few days. The signs and symptoms should gradually clear on their own. Antiviral medication may be an option if the doctor determines that the viral conjunctivitis is caused by herpes simplex virus, that is HSV. Now coming to the management of allergic conjunctivitis. If the irritation is allergic conjunctivitis, the doctor may prescribe one of many different types of eye drop for people with allergies. These may include medications that help control allergic reactions such as antihistaminic of drugs that help control inflammation such as steroids and anti-inflammatory drop. The patient may also reduce the severity of allergic conjunctivitis symptoms by avoiding whatever cause the allergies when possible. Now coming to the home remedies for treating conjunctivitis. First, apply a hot compress to the eye. Second, try eye drops. Third, stop wearing contact lenses. Fourth, reduce exposure to light. Fifth, prevent rubbing of the eye. Clean the eye using sterile water and cotton swab from inner canthus to outer canthus. Then last is use of dark sunglasses is advised in presence of photophobia. Now coming to the preventive measures for conjunctivitis. Practice good hygiene to control the spread of pink eye. For instance, don't touch your eyes with your hands. Wash your hands often. Use a clean towel and wash cloth daily. Don't share towel or wash cloth. Change your pillowcases often. Don't use eye cosmetic. Don't share eye cosmetic or personal eye care items. Although pink eye symptoms may resolve in 3 or 4 days, children with viral conjunctivitis may be contagious for a week or more. Children may return to school when they no longer experience tearing and redness of eyes. So, this is all about the conjunctivitis.